In this scenario, the patient is very close to being on. However, there's still some supinpositional variation in the bony pelvis. We're thoughtful about over-positioning as there's risk to throw the patient further off, but we also know they're not in the right position here either. This technique stays ipsilateral, so it's very effective to adjust the pelvis without impacting your partner. It will also tell quickly if you're not as close as you think, and spending the time to accurately position is going to be necessary. There's an invisible line that runs down the middle of the patient and separates left from right. When you stay inside of your half of the patient and don't cross over the middle, we call that ipsilateral positioning because it does not change your partner's side of the patient. This technique repositions the way the patient's anatomy sits, so you can very quickly and accurately achieve moves approximately 1 to 3 millimeters. In this scenario, my partner is on, center is on, and straightening is on. On my side, the tattoo is about 1 millimeter inf, meaning that my pelvis is sitting slightly inferior. You can see the heel of my hand is going to sit on the patient's anterior bony pelvis, and I'm going to tilt the patient's pelvis superiorly. It's important to have the heel of your hand on the bony pelvis for this move, both for patient comfort that the heel of your hand provides and accuracy of the movement. You should adjust your pressure depending on how much motion you need to see the tissue and mark move in a very controlled manner. You should not be pushing into the hip, which would cause the full pelvis to move laterally. You should be controlling the tilt of the pelvis superiorly instead. Once the move is complete, you can verify the position by checking the fascia with a quick, deliberate pressure to ensure the position is stable, or relax back if you've gone too far. You want to be deliberate with this positional check, and it should only be done when necessary. You do not want to be touching the patient more than necessary, as it can create unintended tension in the patient and put your setup at risk, as well as making the patient uncomfortable. This technique preserves the marks on top and on the contralateral side. Remember, as you are isolating the anatomy on your side, you'll want to move the full distance required for this position.